The issue of stigma, suicide prevention, and clinical managerial research in mental health is a global health concern. The third mental health conference focused on dignity in mental health, psychological and mental health first aid for all. It sought to educate people on suicide prevention and other mental health disorders. Ghana, as a developing nation, has had its share of the challenges such as inadequate drugs, human resource base, infrastructure, and lack of legislation in the mental health delivery system. But according to health experts, Ghana is on the verge of improving the sector due to the passage of the Mental Health Bill, which will help address some of the challenges in the sector. The Australian ambassador to Ghana, Andrew Barnes, says even countries that have made gains in mental health still have challenges with stigma and funding. The president of Royal Australian and New Zealand College of Psychiatrists, Professor Malcolm Hopwood, said societies must start reflecting on how best they can improve mental health issues, especially for the underprivileged.
One of the key elements of reducing stigma is actually having good data about how common mental health problems are. It seems a fairly self-evident thing, but in, for example, debating the degree of expenditure that should occur around mental health, unless we have accurate data to describe how frequent mental health problems are and how disabling they are, we're clearly at a disadvantage.
The Chief Executive of Mental Health Authority, Dr. Akwesi Osei, urged all stakeholders, including the media, to help reduce stigma against mental patients in Ghana.
With the Act, we are advancing towards its implementation. But I must say that we are only just about 5% towards the implementation of the Act. For instance, a major component of the implementation of the Act is the passage of the airline legislative instrument. We don't have the airline, and it's the airline that will establish the mental health fund, the levy. So once we have the levy and we have the money coming into the fund, then we can be sure we will be able to buy the medicines and train the personnel.